Hi, I'm Dr. Joseph Woodering, and the purpose of today's video is to talk about what does it really mean when a health regulator says a drug is safe and effective. And the reason that I wanted to do a video like this is because, a lot of people that are on this channel, they've been really hurt by psychiatric medications. I mean, they've had their life kind of ruined. It's been a train wreck because of some of the problems that they've had. And I can't help but imagine that they must be wondering, how is something like this on the market? How did a regulator say that this was safe and effective? Um, and yeah, how did they even come to that kind of conclusion? So I'm going to go into a little bit of that. As you may know, I have a background in drug regulation. I worked at the FDA a while back, and I've worked at a couple pharmaceutical companies. So here's my perspective on it. The technical kind of definition for safe and effective is that something has a positive risk-benefit balance. Okay, so what the hell does that mean, right? And in kind of simple language, it means that when they did the clinical trial, they had an efficacy measure to measure the effectiveness of it. If you're talking about something like depression, that's like the HAM-D or the MADRS, which are really common scales used to measure the symptoms of depression. And there may be like 17 questions or something like that, and you know they go from like 1 to 5, and the questions are asked in a really standardized way, and it measures depression, and then they'll kind of measure it at the start of the trial, and then they'll go to the end, and if it's trending down in the group that gets the drug as opposed to the group that got the placebo, if the depression is lower in that group, then there's efficacy. And so that's the benefit of it. And then the next part is the risk, and that's where they look at, all of the risks which they observe during that period. So these are adverse events, for antidepressants, commonly things like weight gain, but it could also be things like maybe some increased irritability, anxiety, and in really bad case, sometimes suicidal behavior. And so when a company goes and submits all this data to the regulator, the regulators and the company as well, they look at the data and they go, well, we had these kind of benefits, depression is a really serious disease, we had these kind of risks here. Overall, kind of like looking at the two and what we saw, we think that, these risks are kind of manageable, they're not as severe as the kind of the condition, and, there's a lot of people out there with depression who have really severe symptoms, and we still think this is going to help. And that may actually be supportable. I know if you've been really harmed by the medication, you may not think that it is, but at that time when they do the study, it may be, because one of the things that you want to remember is that most of the antidepressant trials, they were really done in about, 6 weeks to 12 weeks. So these are done in a really short period of time. And honestly, if you look at depression medications, and if you're only studying them in a small group of people, let's say 400 or something like that, you might not see any of the severe rare adverse reactions like people becoming suicidal or homicidal or people developing PSSD or anything like that. You're not going to see those things. So you're just going to kind of see this benefit. So when they look at it, they go, okay, that seems reasonable, and then it gets on the market. And so here's where the problem comes in. The problem comes in is that, the longest antidepressant trial that I've ever heard of, that was like a controlled trial where they had looked at, two groups. I think it was up to like something like a year or something like that. And that is it. And so after that, who really knows? You can't look at benefit risk in the same way. So once it goes into this post-marketing setting, that whole idea of like safe and effective becomes a lot harder to evaluate. You still can, as a regulator or a person in a pharmaceutical company, but it's a lot trickier because now you can't look at it in a quantitative way. So you might be sitting at the FDA and someone calls in and they say, they don't call in. Usually they submit reports, and you're like, my husband just started on this medication and he had a heart attack. You go, okay, did he have any cardiovascular disease? He did. Okay, maybe it's due to his underlying cardiovascular disease. Maybe it's due to the medication. If this was in a controlled trial, and that was a rare side effect, and you had enough people, over time you could say, hang on a second, there's 10 more of these people with heart attacks on the group getting the drug than on the group getting placebo. And you just look at the numbers and you go, a difference of that magnitude is not easy to explain away. The drug is probably causing it. But now you're in post-marketing, it's just people out there, they're just like taking the drug. You don't really know, you don't really have a comparator. And so, things like, say, cardiovascular disease, that's really hard to evaluate in the post-marketing period. But another one which is good to think about is suicidal behavior. Now, with the antidepressants, I mean, Prozac came out in I think it was 89 or something like that. And within the first couple of years, there were already a lot of reports in the medical literature about people becoming suicidal. This was disputed for about 15 years because when these reports were coming in, I guess, drug safety experts and different regulators that were saying, well, how do we really know this is not just due to the person being depressed and they're misattributing it to the drug because they have some kind of media bias? They saw something in the media where someone did it, and now they just think that, the drug made them suicidal, or maybe it's something even more sinister. Maybe they're part of, an organized group that has an axe to grind against medication. Maybe they're part of, like, I don't know, like a Scientology movement or something like that, where they're doing this. And so they kind of dismissed it for a really long time. And it was only 15 years later that they got the boxed warning in for those, for the antidepressants, which really now, when you kind of look at them, it's so hard to justify giving them to children. I mean, right there in the label, it says it raises the risk of suicidal thoughts and behaviors in kids. And obviously these drugs have been approved in children since that time and were being taken by many kids and who were also having problems. So safe and effective in children? Probably not overall. And so I guess the next question is, kind of this overall thing is, I mean, why is it so hard for people to figure out when there's these side effects? And it's a question for regulators and drug companies, mostly we'll talk about regulators because, and I've thought about this a lot because I've worked in all of these settings, and it is, what makes it so difficult. And a lot of the time it can really be just like the volume of these reports coming in, and then the quality of the information in there. And then really at like the places like the FDA not really having, I guess, the resources to go and track dig into some of these cases. Say you're getting like a lot of cases of PSSD coming in. You kind of look through them and maybe they're not written very well, or, it's just someone doing his best to describe it. And you're kind of looking at it, sex drive hasn't come back. There's not a lot of other details in there about, their medical history. And so, you've got like 1,000 other adverse event reports for this drug coming in. You don't really have time to kind of dig into it in that way as the regulator. And so they say, maybe it's just due to depression. Whereas I guess if you were actually doing like a really thorough job on it, it might trigger something where you say, well, you know what? Let's reach out to these people. Let's say, hey, you know what? You sent in this report. We'd like to know more about it. Send us more information, or let's get on the phone or something like that. From my experience at the FDA, this pretty much never happens. It's, they're just kind of reading the reports coming through. And so, these things are missed because the quality of the information that they're getting is not great. I mean, sometimes it is, but most of the time it's not. People don't even really report these things as well. I mean, there's some statistics where it's like only like 1 in 100 people will actually send an adverse event report to the FDA. And oh, by the way, if you're interested in knowing how to send a really great adverse event report to the FDA, there are some videos early on in the channel where I kind of walk through the process of where you can find the adverse event reporting form and get them in there. So a lot of these medications really don't have great characterization of the long-term risks unless it's something that's so incredibly obvious. If it's something like a severe rash where your skin is falling off, and it starts like 2 days after the drug, people are going to notice that. But if it's something more nuanced, if it's something more subtle, if it's something like a drug making someone more irritable, more suicidal, if it's something like, you're having, loss of libido or something like that, and, it could be confused with the condition that you have, it's not going to be picked up. And so there's a lot of drugs out there that people assume are safe and effective for really long-term use. I could be on this antidepressant, safe and effective for, decades, and it's like, that may not be. That really may not be the case. Most of the high-quality data, honestly, it's really in that first, 3 months, 6 months, 1 year, something like that. And then after that, it's who knows. And then the other thing is, in these antidepressant clinical trials and these psychiatric clinical trials, the effectiveness of the drug can often be measured really narrowly. So yeah, they'll have your depression symptoms. Over time, the trials have gotten better and they've added more things in there, quality of life measures, how you're functioning. And a lot of the schizophrenia research now, they'll ask things like, about employment, your social life, relationships. But that stuff too is only there for the duration of the study. So, it may look like when you look at a drug, on the key efficacy measure, and then also on these other measures that try and globally characterize the effect the drug is having maybe on your career and your relationships and such. Even that information it's really short term. And at least what I see in my practice, a lot of people that I'm working with who are on these medications long term, they can start to have a pretty negative effect in these other facets of their life, especially in their relationships. And truthfully, that information is just lost long term. So what I really think is when you're thinking about this drug being safe and effective, or my family doctor has given it to me, my psychiatrist has given it to me, that this drug is safe and effective. One thing you need to keep in mind is that these studies, a lot of them are done for 3 months, maybe 6 months, something like that, and no longer than that. It's not financially viable to do it any longer than that, nor would a drug company ever want to do it any longer than that if there's a precedent set that the study only needs to be that long. And so that is my overall download on, what safe and effective is. It's something that I would consider really anchored to that short period of time when the drug is studied. And really, there's a lot of unknowns which go on after that period. Obvious things are going to be picked up, but more subtle things that are harder to differentiate from your underlying condition, or maybe subtle things in your relationships or at work, or things like that. That stuff is missed. So I hope this was helpful. Please let me know your thoughts on the topic in the comments below. Thanks.